Distinguished ladies and gentlemen, it is currently 20 minutes past the hour of 5 o'clock, and I want to thank you all for your patience in joining us at this particular event. My name is Mininim Oseji of Berachah Community Clinic. I'm also the coordinator of the Senior Citizen Center attached to the clinic. It gives me great pleasure to welcome you to this webinar on aging, tips for staying healthy, being organized by Berachah Community Clinic Senior Citizen Center in Asaba, Delta State of Nigeria. Today marks the first anniversary of Berachah Community Clinic Senior Citizen Center, established for persons who are 60 years and above. Evelyn, could you mute yourself? I'm trying to mute you, but it's not working. And I want to continue with my welcome address. The aims of establishing the Senior Citizen Center include contributing to filling the gaps identified in providing health and other social services for our senior citizens. And the center is specially prepared to provide relaxation, socialization, information, and care for senior citizens through well-being talks, as we're having today, games, arts and crafts, book reading, film viewing, periodic free medical care, and lots more. The time of operation is every Friday from 9 a.m. to 5 p.m. Registration for membership is free, and members are encouraged to come with another senior citizen to make their experience more interesting. Our guest speaker today is Dr. Ogugua, Osi-Ogbu. She obtained her basic medical education from the College of Medicine, University of Ibadan, and residency training was done in internal medicine, including geriatrics fellowship at the University of Pittsburgh Medical Center, Pittsburgh, Pennsylvania, United States of America. She's a pioneer geriatrician in Nigeria, contributing to the well-being of older adults through service provision as a clinician, training of the healthcare workforce in West Africa, sub-region, as an educator, and advocacy and capacity building on aging issues as a member of the steering group of SGA Africa, an executive member of the Geriatrics Association of Nigeria, GAM. She co-facilitated the first SGA Africa Conference on Aging, Abuja 2018, and the Africa Regional Conference on the Human Rights of Older Persons in Africa, Abuja 2019. She has made great contributions as a member of the Technical Working Group on Aging in Nigeria, involved in policy document reviews, hearings on bills regarding older persons, and stakeholder engagements with relevant government ministries and agencies to promote age-friendliness in Nigeria. Thank God, I finally muted Evelyn. She is currently the head of the geriatric unit at the National Hospital, Abuja, Nigeria. Her presentation at the just concluded Women's Health and Wellness Conference powered by the Medical Women's Association of Nigeria, M1, at Abuja on the 27th of June, 2024, was so scintillating, I had to reach out to her to expand the reach of the information to more people. On this note, I wish to thank you all for honoring our invitation and contributing to making this day a reality. Thank you and God bless. I'm Dr. Mrs. Mininim Oseji, Medical Director, Berachah Community Clinic, and Coordinator, Berachah Community Clinic Senior Citizen Center. I will now share the slide of the presentation so that without further ado, we go on to the activity for today. Yeah, there you go. Dr. Osi-Ogbu, can you see your slide?
Yes, I can.
Right.
But I think
So
it needs to go to the slideshow mode. Good evening, everyone. Good evening, Dr. Oseji, my former president. Dr. Oseji was a national president of the Medical Women's Association of Nigeria and brought on a lot of initiatives during her tenure that we still remember up till today. And again, you know, you have initiated this, the Berachah Community Senior Citizen Center just tells us that you find a gap around you and you fill it. Congratulations. I congratulate you on this first anniversary of the Berachah Community Senior Citizen Center Clinic. And it's amazing, you know, just hearing you talk about the fact that registration is free. So, you know, older people in Asaba are really blessed to have a community center like you have created. Hearty congratulations to you and your team now. So good evening again to everyone who's listening. Yes, this was a presentation I made last week at the conference of the Medical Women's Association that was themed Women in Medicine, Health and Wellness. And like Dr. Oseji mentioned, she thought it would be a good conversation to be shared with many more people. I will try and gloss over some of the more medical terms as I go through this slides this evening. And to all the senior citizens out there listening to me, I salute you. And to those aspiring to be senior citizens, make sure you're taking good care of yourselves. Can I go ahead? Let me see if I can actually pull up my own version.
Yes, you can go ahead. I've muted the interference.
Right. Okay, so the slide could move, you know, saying to put it on slideshow. Okay, so I'm going to be using this outline. Just tell us a little bit about some of the aging changes that we expect. So this presentation was actually geared towards aging and women. So you might get that it's a little biased towards that, but as I go through the slides, I will try and bring up some of the more general things. Next slide, please. So I usually ask this question, you know, when does aging begin? And it's interesting that some people, even at 55, feel that aging doesn't start until you turn 60 or 65. You know, I don't know if people want to put any answers on the chat, but really, just for us to note that aging is a dynamic process. It's continuous, and unless we die early, we will experience the changes that come with aging. So we always used to think that it started from birth, but we have adequate evidence now that the condition that any fetus, you know, when a pregnant woman is pregnant and she's in an environment that is abusive, or maybe she has hypertension, diabetes that have not been well managed, if she's an alcoholic, all of that affects how that baby actually develop subsequently. Next slide, please. So we will all experience the aging changes for as long as we, we remain on Earth for a long time. So French woman is the current record holder of the person who's lived the longest, and she lived for 122 years. But I have had conversations with some Nigerians who tell me about their grandparents who lived up to one particular lady said 130 years. So I guess our poor documentation capacity around here might make us miss that record. So many we might, but the import of this is really for us to know that we can live this long. The question then is, why is it that some people are living even half the age of this woman? And it all has to do with lifestyle. Next slide, please. Can we go on to the next one? Right, so this really shows us those aging changes. Please go back one slide. Okay, great. So on the left, organs when they still look good, and healthy brain with neurons that are intact, our eyes where there's no cataract, healthy ear, our blood vessels. But when you come to the right side, you can see those changes where the blood vessels are becoming narrow. And if that is occurring in the heart, that puts one at risk of heart attack. When it's occurring in the other vessels outside of the heart, it increases the risk for high blood pressure, and also increases the risk for strokes, especially if it's affecting the blood vessels around the neck. With aging, we develop a very opaque film in the eye, the area of the eye that we call the pupil, and that's what we describe as cataract. And what it does is it stops light from coming into the back of the eye, that allows us to be able to appreciate whatever we are viewing. So cataract reduces our capacity to see, it dims our vision, and we find that really common as people are aging from about the age of 40. With aging also, we get changes in the ear that causes a hearing impairment that is age-related, something we describe as a sensory neural hearing loss. And people who get this kind of age-related hearing loss can still be helped. But if we decide to leave them at home and say, oh, mama or this older man at 75 or 80 is already old, even if he doesn't hear, it's expected. And so we don't get them to a medical facility. So everybody, regardless of age, must have access to good quality healthcare. And when anything is going amiss, we need to know that aging is not a disease. It is just a major risk factor for disease conditions, for disability. So when we see hearing impairment, visual impairment, we need to take such older people to the hospital so they can get help. So for those who develop this age-related hearing impairment, they can be helped with the use of hearing aids. But if you leave them without any assistance, any aid, they no more can engage with society. Their quality of life is really poor. So it's important that we understand that. The other changes that we see in the lungs, especially those who are lifetime smokers or have been exposed to significant secondhand smoking, they can develop what we describe as chronic obstructive pulmonary disease, and it affects breathing. Some of them end up needing oxygen to actually be able to to function, to survive. You see them carrying an oxygen cylinder, and constantly they have an oxygen pipe going into the nose. The other thing that tends to happen with increasing age is the incidence of cancers. So increasing age is the biggest risk factor for developing cancers of different types. But we also know certain other lifestyle behaviors like smoking and chronic alcohol use that also increase our risk for cancers. As we age, the muscle bulk around our bones tend to get thinner and thinner. And we describe that as sarcopenia. Concern with sarcopenia is as we get older and that muscle bulk is even smaller, it means the capacity for walking, such individuals become at risk for falls. So we are concerned about sarcopenia as we age, and there are things we can do. Having the practice of exercise throughout a life course actually helps to ensure that we do not lose so much of our muscle bulk and don't develop sarcopenia that increases our risk for falls. The other thing that happens with the increase in age around the muscle and the bone, particularly in the bone, is what we describe as osteopenia, which is just the bone becoming thinner and not as thick, the bone marrow becoming thinner. And at the other extreme, the severe form of that bone thinning, we describe as osteoporosis. And what happens with osteoporosis is with very minimal impact, people with osteoporosis will get fractures in their bones. And we tend to find this very commonly in older women. Another change that we see with aging is that our immune system becomes weak. And we all saw that with the pandemic, with COVID-19 pandemic, where majority of those that succumbed to the infection, COVID-19 infection, were older people because of the reduced immune system. So just for us to note that there are aging changes that sometimes makes us think about older age being a disease state. And so people not wanting to seek medical attention. But so aging in of itself is not a disease, but a big risk factor for diseases because of the aging changes. But these changes really do not have to occur at a rate that would reduce function for us if we can adhere to some of the lifestyle changes that I'll be talking about subsequently. I think the other thing I didn't mention here is the degenerative neurons. Again, increasing age is a big risk factor for dementia, where people lose capacity for self-care, they start losing memory, particularly more recent memory, and it's becoming a really concerning condition now globally. We really would like people to age without any of these disease conditions. Next slide, please. So I did say that this talk for the Women's Conference was tailored towards women, and basically what the slide is pointing to is the fact that across the life course, women have actually been disadvantaged in a way. So a child is born, you're female, as you're getting old, into your early adolescent years, you're the one being called to the kitchen and you're being groomed to be a champion in the kitchen. And while your male, your brothers are nurtured differently. So women carry that role of caregiving, of being homemakers throughout the life course. And in my clinic, I find women who are not prioritizing their own health because they're looking after their spouses and they're looking after their children and they're looking after their grandchildren. So it's something that's been ingrained, particularly in this part of the world. So that increases the risk for women being more frail in their older age. That's why we also tend to have more disability in the older women than we would find in the in the men. Something I would also like to point out here is there's a particular kind of cardiovascular disease that we're finding in women that where we get, there's a phenomenon now called MINOCA, MINOCA. I actually thought I had it somewhere here, which is myocardial infarction with non-obstructive coronary arteries. So when we see myocardial infarction, or in simple terms, heart attacks, they tend to happen where there is a blockage in the vessels supplying the heart muscle. But new evidence is coming on now that in younger women, we're finding them developing heart attacks, and we're not seeing the blood vessels being blocked. That's why the term non-obstructive. And the thought is that it's more of a spasm of those blood vessels rather than a blockage. So a lot more attention is being paid to this by cardiologists. And when we find heart attacks in younger women, we really need to think about MINOCA. Next slide, please. So these are some of the aging concerns, in women, and really for everybody, a man or a woman. So we talk about geriatric giants. These are conditions that tend to affect quality of life and functional capacity. And those are two critical elements with older people. So the conditions are put there in red are the ones that we really describe as those giants because they have great impacts on functional capacity and quality of life. So mobility and falls, remember I had mentioned sarcopenia and osteoporosis relating to that. Urinary incontinence, where people have accidents with urine. You can imagine such a woman or a man would not want to be out and about because of the shame that could come with that. So it really impacts on the quality of lives of such people. Sensory impairments, the visual impairment, losing capacity for hearing. Again, these are things that will make people just want to be homebound rather than being out to engage with society. The fourth geriatric giant is dementia, which I mentioned earlier. People lose capacity for self-care and can't and lose memory. So at the earlier stage, when this older persons identify that they have this gap, they really don't want to be out there with anyone. So cardiovascular disease, okay, I guess this is a slide where I have the MINOCA. So cholesterol being excessive, high blood pressure that is not well managed, diabetes not well managed, all of this increase the risk for developing stroke or heart attack. So again, increasing age actually is a big risk for us developing this condition, which is why we refer to them too as lifestyle related. So people who are overweight, people who are sedentary in their lifestyle, in their daily lives, have a higher risk of developing hypertension, diabetes, when you also don't eat healthy, when your food has more saturated fats, more carbohydrates, and less of the vegetables and fruits, you're also at risk of developing all of this. And of course, I mentioned earlier, the big risk factor of tobacco use all increases the risk for developing stroke and heart attacks. Cancers, again, an increasing global problem, and there are recommended screenings for us to detect some of the more common cancers. Mammography for breast, lung cancer for those who are a really major risk. We start with an X-ray and it can escalate up to other images like a CT scan. Colon cancer, we recommend that everybody screens the general population from the age of 45. But if you have a family history, you even start screening 10 years earlier. So if you had a family member who developed colon cancer at 45, it means at 35, you are beginning to screen for colon cancer. The other issues that we find with aging, particularly with women, is the risk of isolation because of the burden of disability. Those who are very dependent on others, either because they don't see, they can't hear, or their legs, they have such severe joint issues, particularly arthritis of the knees, that they really can't move on their own. They become dependent on others, and that puts them at risk of abuse, of neglect. We also know that with increasing age, you're retired, so income is lost. If you have any retirement income, it's definitely way below what you used to earn. So a lot of older people are actually poor unless you've had good financial behavior as you were aging. And there's also the burden of caregiving. We're finding a lot of older people today who are caregivers themselves, either to a spouse or to their grandchildren. So really, for this older people to continue to fill these gaps, they need to be healthy. So when they have the burden of ill health, it increases their risk for anxiety, for depression, and all of that. Now, I just wanted to put here, well, this will be more relevant to the doctors, that as we manage older people, we sort of use this 5 M's to streamline the evaluation and the assessment. So we look at the mind, mobility issues, medication issues are really important because older people are at risk of having adverse effects. And let me throw out a caution here that there is this practice of somebody gets sick, they go to the lab, and then they go to the pharmacy. And that's not an appropriate channel. You need to go to the doctor when you're sick. The doctor, evaluates you, determines whether or not there is a need for you to run certain tests based on whatever the suspicions are for what might be going on with you. Then you go run the test, you come back to your doctor, and the doctor is giving you a prescription where that might be necessary. There are so many conditions that we manage in the field of geriatrics where we do not use medication because of the risk of adverse effects or side effects. Multi-complexity, we look at our clients holistically, not just the disease conditions that they are having to cope with, but also the other social issues, what's the dynamics of the family, because we know that all of these social issues also have impact on how they cope with their physical disease burden. And we always bring in the preference of the client and their family members. And that's our last M, which is what is it that matters most to this individual? So we always like people to prioritize to us their concerns. Is it the capacity to see, to hear, which is the major thing that we must address to improve quality of life.
Let them be quarreling with yourself. Now, they accept that they quarrel with.
Next slide, please. I think we missed one slide. There's one slide that was about, yeah. Okay, so aches and pains of aging. So there are, the aches from the physical issues such as the arthritis, which tend to affect the knees, lower back, the hip, the neck. So we get those aging changes, just part of the wear and tear. And it's really, it can be disabling and debilitating for some people when they have chronic pain. So it has become a serious public health problem because a lot of people are living with the pain of osteoarthritis, and it does impair quality of life. There are also psychological aches, that of loneliness. There was a WhatsApp message I came across recently where this older man locked up his the box, his mailbox, because he wanted the newspaper man to always come and knock on his door. He didn't want him to just put the newspaper in the mailbox. He wanted to be able to interact with someone, because if he dropped it at the mailbox, he lived alone, his wife had died. So one day the mailman asked him, why is it your mailbox is locked, you know? And he says, no, always come and knock on my door. And the day you knock and I do not respond, please call my son. Here is his number. Call for an ambulance because something might have happened to me. So there's a lot of loneliness that our older people are dealing with. And if you're listening to me, you have an older person, make sure you're checking in on them. It's not just about the money that we send or food, but actually being there to socially engage with them. They're also dealing with pain from the loss of significant others. A man who's lost his wife, or a woman who's lost her husband. Some have lost offsprings, not just spouses. Of course, they've lost job, their income is reduced significantly. All of that contribute to them having high levels of anxiety. And some actually can develop depression from that. There are also social stressors from the dynamics of what's going on with them. I had a woman come into the emergency room with severe, she felt she was not breathing well. She felt a pain in her chest. We ran all the tests looking at her heart. We really didn't find anything there. But on further conversations, we realized that she was under tremendous psychological strain from the fact that her 4 children, who were all over the age of 40, despite her desire to have them be married, they were all married. And so she also didn't have any grandchildren. And that was a lot of burden for her. So these are things we also are able to address, because we give holistic care, we involve other experts when we provide geriatric care. So psychotherapists, social workers, is a multidisciplinary approach that we give. Next slide, please. Okay, this is just really to tell, show us a slide on osteoarthritis and the severity. It can get so severe that people become chair bound and they're not able to move. So we really don't need to get to that severe stage. We can start doing something from early on. Weight management is one of them. If you're overweight, being able to reduce weight, because especially our knees, they're carrying almost all of the weight of the body. And this is what I always say to people: do not size up your clothes. So when your clothes start getting tight, rather than size up to the next, so you're size 10 and you go up to 12, please try and lose weight to continue to fit into your size 10. Because that habit of sizing up is what gets people, getting much bigger than they're supposed to be, having a very high BMI, and that worsens that aging joint problem. So they get really bad arthritis and they can actually become homebound from that. This just shows us the common areas where we tend to find those degenerative changes in the joints. So the neck, the lower back, the hand, and all of that. Next slide, please. So how is it that we help, well, that people can cope with these aches and pains. Exercise, major intervention across our life course. So we need to make exercise a way of life. Don't wait till you're 60 to start exercising. It should be a part of our daily routine for everyone, young, old, everybody, exercise. And we say that we should all get at least 150 minutes of quick paced walking every week minimum. And that translates to about 30 minutes of walking at least 5 times a week. If you can do this daily, that's super. We also want another target to remember is 10,000 steps a day. And what that means is we can't be sitting for a prolonged period of time. So my recommendation usually is maximum 2 hours, you must get up and walk for at least 3 to 5 minutes before you sit down again. And if you're not able to move away, maybe you're working on your laptop or something, you get up and take the steps while you're standing behind your chair. Important thing is we want people to keep moving. Ensure that you use adequate, posturing, especially for those that have neck and back pains. You must use a chair that is high enough to give you support and not the one that you sink into. You also must avoid prolonged standing, just like we say, avoid prolonged sitting. For the prevention of the risk of falls for those who have really bad joints, make sure that you are able to get a walking aid. Make sure that you have proper footwear. So I see people taking their walks wearing open toe slippers and all that. And those are often so hard. There's not enough cushion. So we really recommend that everyone should wear appropriate footwear for you to take your walks, and the appropriate outfit for you to take your walks. Weight management, I cannot overemphasize that. Please do not size up your clothes. Make sure that your BMI is maintained within normal, which we say is 19 to 25. But, for our older people, we even allow it up to 27. For painful joints, you can use compresses. So either you use ice that is wrapped up in a towel, or you use a warm towel, depending on whatever you like on your skin. They tend to soothe the muscles around our joints and make them less painful. There are braces that can be used to stabilize the joint, particularly for the purpose of walking. For some people with severe arthritis, particularly of the knees and hips, stop walking because of the pain, and they gain more weight, and it makes even movement a lot worse. There are walking aids that people must not be shy to use if they need them, because we don't want anyone falling, particularly in the older age group, having a fracture, remain in the hospitals. We've seen very bad pressure sores that keep people in hospital for months. So we really don't want anyone having that fall. Use a walking aid, depending on the severity of support that you need. It could just be a walking cane or stick, and you can titrate that off to a frame just to give you support and prevent any falling. For the social issues, everyone should have a meaningful group that they connect with. And studies have shown us that when people are socially connected, they tend to do better with aging than those who are not socially connected. Programs such as the Berachah Community Senior Center also help, because people come to such a center, they share experiences, and you then find out that whatever you're dealing with is not peculiar to you, and it makes it easier to actually continue to cope. Being able to provide adequate housing, just making sure that we relieve the financial burden that our older people are going through. And there's now an agency of government that was set up to cater to the needs of older people. It's called the National Senior Citizen Center. And over time, one of what they plan to do is actually set up model centers. And Dr. Oseji, you're already taking a lead with the Berachah Community Senior Center. So we want senior communities where older people can actually engage with themselves. We want opportunities for them to continue to learn. So our universities can set up certificate programs just for older people to come and share experience. It could be gardening, it could be flower arrangement, it could be writing, anything, just so that this older person can continue to have, they have access to do what they really desire to do. And at the end of the day, we must have access to good quality, affordable, and age-centered care. And for healthcare to be affordable, it means social insurance, health insurance must be provided. For some of these social issues, we also need social insurance. And those are two areas that the National Senior Citizen Center is also looking into. Next slide. All right, so this is just showing us some of the braces that we can use to support the knees, the back, the neck. And this picture to the extreme left here is just to show us posturing. See, there's a lot of pressure on the muscles when you're sitting and there is no support for the back. Compare that to here, where you have support and you're sitting upright and your computer is at your level. And those are the different types of walking canes or sticks, depending on how much support one needs. This chair is just to show us that we need sitting equipment that is appropriate to actually support our back and reduce pain. Next slide. So it's really not always about the medication. This interventions help a great deal because the medications are only for short term, but if we're able to engage in this lifestyle changes to keep our back healthy, we will be pain-free for the most part. So exercise, exercise, exercise. I cannot overemphasize that. Make it a way of life. Next slide. Okay, this is really just showing evidence that there are things we can do to make sure that we don't develop things like hypertension and diabetes. There was a study that looked at over 200,000 people, follow them over several years, and the things that they found commonly in those who developed diabetes were not maintaining normal BMI. So people who had BMI that was above normal were more at risk of developing diabetes. Those who did not engage in moderate sweat-inducing exercise for at least 30 minutes, like I described, those who did not smoke were less likely to develop diabetes. Healthy diet that was high in fiber, vegetables, low consumption of saturated fats, and little or no drinking. Those were the ones who didn't develop diabetes mellitus. Now, I also want to mention here, as we get older, particularly women, menopause increases the risk for cardiovascular diseases. So it increases the risk of developing hypertension, which is a major risk factor for strokes. And it's also a potentially modifiable risk factor for dementia. And people, after every stroke, there is loss of brain cells. And that increases the risk for developing dementia. Next slide, please. I'd just like that everyone who's listening to me can recognize a stroke if it's happening around them. And there's a very simple way, it's called FAST, F-A-S-T. F for face. You find that the face of the individual becomes distorted, the mouth is drawn to one side. You ask the person to lift up both arms and you find that one arm is hanging up and the other one can't go up. S is for speech. You ask them to say their name or say something and you find that the speech is muffled and the words are not coming out right. The T is for time. Once you find F, A, and S, or even any of those two, you have to get the person to the nearest hospital because time is brain cell loss. So we all must be able to recognize stroke when it's happening around us. And there are a lot of the risk factors for stroke are really modifiable or preventable. Blood pressure that is not controlled, being a smoker, being overweight, diabetes, high cholesterol, heart disease, and of course the one we really can't control is increasing age. So, but these other ones are modifiable, and if you belong to a category of people that have any of these conditions, make sure that you're actually following up with your doctors to make sure that you bring them under good control so that you do not develop a stroke. Next slide. All right, so remember I mentioned that there are 4 giants of geriatrics. Urinary incontinence is one of them, and I found the study very interesting where they looked at highly functioning women. These were not people with any disability. They were fine otherwise, but a number of them had what we call urge incontinence. You feel like going to pass urine, and as you're walking there to go do your business, you actually find that the urine is dribbling down. And the risk factors for those were those who had COPD, the obstructive airway disease that I mentioned earlier that could happen with increasing age, particularly in people who smoke, people of white race, people who were using estrogen, particularly for perimenopausal symptoms, those who had arthritis. And we do see a lot of those with arthritis in our practice who have what we describe as functional urinary incontinence. They sit there, the urge to pass urine comes, and because they're walking so slowly, they do not have enough time to get to the toilet. So what we actually recommend is, again, remember I said maximum 2 hours, you must get up and take a walk. During that period, take a walk to the toilet to ease yourself so that risk of incontinence doesn't happen. And again, another risk factor is high body mass index, being overweight. So weight management is another intervention for reducing the risk of urinary incontinence. Next slide, please. One other thing to mention here is, again, urinary incontinence is one of those that increases the risk for social isolation, for loneliness, anxiety, depression. It does affect quality of life. It's something that we always ask about in the clinic, and we have a very nice way of asking about it so that people don't feel ashamed. We always ask about it in the form of an accident. Oh, mama, before, when you're walking to the toilet, do you sometimes have an accident with the urine? Because you don't, again, want them, they already feel vulnerable that this is happening. They don't even want to discuss it. If you now ask it in a way that makes them feel worse. So we try to make sure that we're asking around these questions in a way that is non-threatening and doesn't make them feel that it is their fault. Now, sensory impairment, also something that affects quality of life and functional capacity. Increasing age is a risk factor for things like glaucoma, cataract. We also have age-related macular degeneration. So we recommend that every year, everyone should get an eye check. Part of the glaucoma just means that you have high pressures in your eyes. And the only way we can find that out is for us to check. So clients are always recommended to get annual eye checks. We look for the cataracts, look for glaucoma. And studies have shown us that where visual impairment, sensory and hearing impairment coexist in any woman, it tends to increase the risk for things like dementia. So these are things that we really must identify in people early. Again, I mentioned earlier with the sensorineural hearing loss, hearing aids can help to improve hearing and make the individual continue to engage with society. We do find that some people have barriers towards using this aid. Some don't even want to wear the glasses. Some don't want to use the hearing aids just because they don't want to be seen to have an impairment. But we must embrace whatever our new normal becomes as we're aging. So you need the glasses, you need the walking stick, please use them so that you can continue to engage. And when we're going to have many more people getting old. We're estimated to have like 2 billion people by 2050 who will be over the age of 60. And for the first time in the world at that time, we'll have many more over 60 than we would have below 14. If you remember the pyramid, it's always been tapering up, but it would almost be turning on itself by 2050 because of the increasing global aging. Next slide, please. Okay, so these are the things that we need to do across the life course. So you're a mother, please start these interventions with your children. Stop feeding them sodas and the cakes and the meat pies, and we all must imbibe a healthy lifestyle across the life course. So restorative sleep, and there's adequate number of hours recommended per age, but for all adults, we're looking at 7 to 8 hours per night of restive sleep. Meaningful social connection, I mentioned that earlier, eating more plant-based foods, beans, whole grains, rather than the animal sources. Even our proteins to be plant-based. There are there's certain communities in the world where people have lived much longer than has been seen in other parts. And those areas are termed the blue zones of the world. There's a particular community in Greece that is called a locality, Ikaria in Greece, where they actually describe that people who have forgotten how to die because their life expectancy is in the 90s. And what was found about the lifestyle of these people, they eat more plant-based foods, a lot of legumes, a lot of grains, a lot of beans, and there's a lot of movement involved in their daily life. So routine physical activity, avoid undue stress. We must learn to pace ourselves. Whatever you can get to do today, tomorrow is another day. Don't stress over it. Avoid excessive caffeine use, avoid alcohol use, and of course, tobacco use. So these are lifestyle pillars that we really should all try and imbibe across the life course. And it's never too late. Even if you're only going to start today at the age of 65 or 70, you will still get tremendous benefit from imbibing this. Now, the one other thing that is not on that list is that you must do annual checks. And it's recommended that we can do this, give this annual checks to ourselves as birthday gifts. So a week to your birthday, check in with your doctor to make sure that things are all well with you. Your blood sugar check, your blood pressure check, cholesterol check, all of those risk factors that we mentioned earlier for cardiovascular disease and things like stroke and dementia, like I mentioned. Next slide, please. So what it means is we all must identify a doctor. Everybody must have a physician, and every year you're going in to see such a physician. This is just to show evidence that physical activity improves, helps us with healthy aging. Sleep also is required for healthy aging. Next slide. Okay, so this is really part of what I already mentioned before. So nutritional care is one of those healthy aging strategies. Eating reduced calories. So the Japanese have a saying before every meal. And the saying really is reminding themselves that they should only be 80% full. I remember somebody said, how do you know whether you're 80 or something? But generally, don't overeat. And if you're telling yourself that before every meal, you're less likely to take excessive calories. Caloric restriction is actually one of the ways we're looking at now for making people live longer. without any of this lifestyle related conditions. So nutritional care, again, across the life course, very important. Avoid sedentary lifestyle. I've talked a lot about that today. Health promoting life choices, no use of drugs of abuse or substances of abuse. Let's try and avoid taking over-the-counter medications that have not been prescribed because there is an identified diagnosis. So this practice of just walking to the pharmacy and getting drugs should be avoided. Prevention and early detection of diseases. I mentioned earlier that we must go in every year so that we can track our numbers. Also, to be able to do the gender and age-specific screenings for us to detect cancers early. Next slide, please. So I did mention this earlier, the colonoscopy, pap smear, mammography for women, for us to detect any evidence for cervical cancer or breast cancer. Screening for vitamins, low levels of vitamins. We're finding a lot of older people having low levels of vitamin D, and vitamin D is required for muscle, bone, immunity, cognition, for our mind. So really important that we detect those who have low levels and we can boost them. Immunization, very important for vaccine preventable diseases. Pneumonia is one of those vaccine preventable diseases. So we recommend the pneumonia vaccine to our older adults, 65 and above. And for those who are even below 65, who have certain conditions like diabetes, chronic kidney disease, chronic liver disease, we also recommend the pneumonia vaccine. Good personal hygiene. Dental care is one of those areas that we tend not to pay good attention to. Everyone must go into the dentist every 6 months to get what we call a scaling and polishing, which is really just to do a good clean. Because what we do on a daily basis doesn't get to the tiny areas, but also that we brush our teeth, if possible, after every meal. If you're not able to do that, at least twice a day. The morning, just because you want to have a fresh breath. The more important one is the nighttime, because we want to reduce the debris of food that you've eaten throughout the day, so that you wake up the next morning also with a fresh breath, and you haven't left bacteria, you haven't left debris there for bacteria in your mouth to work on and give you a lot of caries and all of that. Skincare, really important. We all must use sun protection on our skin because of the danger from the ultraviolet light that increases our risk for that increases the aging changes on the skin, in addition to the risk for skin cancer. Social connectedness, I already mentioned that. Spirituality, there have been studies that have shown us that those who believe in a higher being tend to manage stress better than others, and it's also been linked to better management of even some of the lifestyle related conditions that we mentioned earlier, hypertension and diabetes, anxiety and depression. Next slide. So all of what I've said so far are things that individuals can do, but to support and promote healthy aging, we also need certain things we put in place at the national level, institutional level. So aging, we know, is intersectoral, is multi-disciplinary. Environment is important, water and sanitation issues. So we need policies that would ensure that we have high quality of life where people can actually continue to engage and participate. So health, security, financial security, that people have adequate income, and will reduce the burden of the caretaking experience of women. So if women remain as caregivers, there must be some kind of social insurance that takes care of that time that they're sitting at home to provide care when they could be out earning some kind of income. We also need to make sure that we help older people to live with their sensory and physical impairments. That means we must have a government, an agency, or an institution that provides all of the aids, assisted devices that they need, and those devices should come at affordable prices, where we can give them entirely free. For instance, the Berachah community could engage philanthropists, and you identify those who need all of these assistive devices, and they actually can get help from the philanthropist. Getting a hearing aid today could go between 2 to 3 million naira, and that's a lot of money, quite unaffordable to a lot of people. So government must find a way. This is where the national level policies that can help to ease the burden that our older people are going through in being able to procure assistive devices. We must provide dignified living options that allow for interpersonal connection. Right now, we find older people being so dependent on living with their children, and that dependency increases their risk for elder abuse. So being able to provide affordable housing for older people would also be one of the interventions that government can actually put in place to ease the burden of Nigerians as they're getting older. End of life issues, palliative care issues. We're finding older people who leave the world and then put their family members into a lot of disharmony, where there's there's no unity because there was no will. So every adult must really have documented will. We also recommend that people should have what we describe as an advanced care planning, meaning if you get so sick and you're not able to make decisions for yourself anymore, either because you have dementia or you're so ill, you're in the ICU, it needs to be documented, the things that you would want done for you. The people who don't want to be on the ventilator, they're those, oh, I get to the point and I'm needing a tube to breathe, please don't give it to me. Or, all that should be stipulated, and those are usually stipulated in what we call the advanced care planning document. I just put there some of the stakeholders involved in aging in the country: the National Senior Citizen Center, Federal Ministry of Health, and other ministries that are relevant, NGOs like the Geriatric Association of Nigeria, Gerontological Association of Nigeria. MOAN should definitely join that group, so they're contributing to improving the well-being of older Nigerians as they age. Next slide, please. All right, so in conclusion, just for us to see that we can all think about conscious aging as a goal that we can strive for by taking proactive steps in our younger years, maintaining a healthy lifestyle, staying mentally and socially engaged, prioritizing self-care and stress management, and prioritizing preventive healthcare measures. We can set ourselves up to a fulfilling and vibrant life as we age. It is attainable. We just need to make it a way of life. And it's never too early to start taking care of ourselves, and the benefits of these behaviors will be felt for years to come. Next slide. So Nigeria is living longer just like the rest of the world. I think I've already mentioned most of what is on this slide. To remember, osteoarthritis, chronic joint issues that can lead to disability. So weight management, very important intervention for us to manage osteoarthritis. Again, healthy lifestyle to reduce those lifestyle-related diseases and their complications, and the fact that we must get comprehensive assessment. So please make sure you have a doctor, you have and not going this doctor this week or the next doctor next month. Stick to a doctor that you have trust in. Next slide. Senior centers help to curb isolation and loneliness. I again congratulate Dr. Oseji and her team for the Berachah Community Senior Center in Asaba. And you know, at those centers, they can learn new skills, can go on retreats, they can go on field trips. You have workshops, which you already say you've been doing with them. And it allows for the establishment of new relations. The younger people who are working at such centers learn from the older ones, and the older ones are also learning from them, particularly in the area of IT. Access to health and social insurance will reduce dependence and risk of abuse. Older persons to embrace aging changes as new normal, yeah, and not be shy and want to just sit at home and not be seen by other people. Need for the health system to align with the peculiar needs of older persons. So we need our healthcare workforce to understand these aging changes, not see aging as a disease, and actually treat our older people with respect and dignity that they deserve. And we need longitudinal research with data disaggregated to show us the different concerns and challenges that older persons are facing. Next slide. I think I'm actually basically done. Okay, so this really, I like this slide because it was actually referring to chronic joint pain management, but really can also address stress management. And weight management, about losing a gene size, schedule regular exercises. Like if swimming is your thing, you can do that. Start using a shoe insert. Remember I talked about using an appropriate shoe footwear, especially when you're going to exercise. Leave the housework for another day, especially women. Take a yoga class or meditation. It helps a lot with stress management. Take your medications if you've been diagnosed with a condition. Please don't say it's not my portion, and so you don't take your drug and you're just doing faith healing. Please combine the spirituality with the medications to get better control of your conditions. Sugar and salt we really don't like, and the fats, so you cut them down. Don't sit for long periods of time. Remember that no is a perfectly acceptable answer. If it's too tight to schedule, just say, oh, I'm really sorry, I really won't be able to do this at this time, so that we really are not under undue stress. Thank you very much. I think that's actually my last slide. Yes, so to remember this, that we really want people to live longer. We don't want disability in those years. So, and Abraham Lincoln had this quote that says, in the end, it's not the years in you that count, it is the life in the year. So in geriatric practice, we want to try and improve the life in the number of years that people have to live. And a former Director General of the WHO also made this quote: health is a fundamental human right. Our goal should not be solely to extend lives in the physical sense, but to ensure that the added years are worth living with diminishing handicaps and disabilities, and with a greater degree of health security. I thank you all for your time, and I hope and I wish Dr. Oseji and the Berachah community a wonderful anniversary. And I pray that you continue to make impact in the lives of the older people in Assam and beyond. Thank you all very much.
Thank you so much. It's been amazing listening to you. I just didn't want you to stop, Dr. Osi-Ogbu. I asked if people had questions that they should post them on the inside the chats, and I haven't seen, but I have a couple of questions before we wrap up. Okay. And first of all, I would like to say I'm so excited about your summary where you said senior centers help to curb isolation and loneliness, skill acquisition. We've actually organized 2 sessions on digital skills, because one of the things that we believe can curb loneliness is if you're able to do a lot of things online, remotely, so that you don't need to physically be there. If you have mobility issues, You will, if you have mobility issues, moving around may be a problem. If you have economic issues, paying to move around may be a problem. So if you could do a couple of things remotely, and we find out that many of our senior citizens, they are not even on WhatsApp to hear some of the jokes that you get from various platforms and things like that. So we decided to teach them how to, use their phone to do a lot of things. Then the issue of field trip. We've actually had a tour of Asaba, a guided tour of Asaba. Went to the Niger Bridge, Nelson Mandela Garden, Mungo Park House, and there was a lady that was over 80 years. She said she has lived in Asaba for over 50 years, and she has never known that there was a place like Mungo Park House. So it was a day of happiness for all of them, workshops and so on. So I'm excited. That was one of the things that excited me when I heard your presentation, that these things you are actually asking, recommending that people should do, we have started, but we have a lot of challenges. And I'm hoping that the NSCC, the National Senior Citizen Center, they would see how they can address some of these things. I'm going to mention some of them. Number one, there was this training for caregivers in Benin, and the training was going to cost 150,000. And these caregivers, they are not nurses, they are not community health extension workers. They're supposed to be people like house helps and housekeepers who are taking care of senior citizens. So we found that it's not an age-friendly program. If you're going to train caregivers, it should be close to free, So I think the NSCC needs to look at that. Then the issue of telemedicine, like in the UK right now, everybody knows that there's long waiting time for consultants appointments, surgical appointments, and even in the accident and emergency, you have to be practically dying for them to see you within the next 30 minutes of arrival. Most times in the A&E, 4 hours. So the issue is, what they do is that if you have a complaint, you call first, and they take you through some algorithms to ensure that it's not an emergency, you don't need to call the ambulance. And if there are things, home remedies you can take, they tell it, they give it to you over the phone or recommend. It's only when you really need to see a doctor, then they now say, okay, go and see your GP or come to the accident and emergency. Why can't we do that for our senior citizens, many of whom cannot come and sit and wait for a very long time? And then the other issue is also home-based care. A lot of senior citizens abroad have social workers and other health workers, including consultants, mental health specialists, who visit them on a regular basis for those who have dementia, Alzheimer's, and those who just are elderly. It's all provided in the NHS. We don't have anything like that in any of our insurance programs, whether state or federal. So NSCC, you will need to look at that. Then the issue of urinary incontinence. I understand what you say, that people should go every 2 hours, be walking around and use the opportunity to ease yourself so you don't need to run. But you find out that one of the reasons that people delay in going to ease themselves is sitting on the toilet can be difficult for some senior citizens because of the arthritis and so on. And our toilet seats are low. And in public places, like even in hotels, conference halls, you don't have accessible bathrooms. Like over there in the advanced countries, every hotel facility must have accessible bathroom so that you have the handholds and so on and all that. We just have accessible bathrooms in just a few of our airports bathrooms. But in many hotels in Nigeria, it's not there. Shouldn't that be a policy that, let's say, even if you cannot do it for all the hotels, you can say from 3-star hotel and above, you must have accessible bathroom so that people don't need to climb over a bath where they could fall and all that. So you see why one thing I love, and one of the things I'm trying to pick from the Western country, is that when you see the way they pamper and pet the senior citizen, you will begin to wish you are a senior citizen. You want to fast forward. They gather them in groups and go for tours and so on. Sometimes you see them in couples dancing in the street and people are playing music, and they have all sorts of facilities that can make them enter the bus easily, can make them come out of the train easily, whatever you need to do. So no matter what the impairment, even if you're on wheelchair, they will bring out a ramp. Everybody will stop, they'll stop the bus, stop and bring out a ramp and slide your wheelchair. And many of these wheelchairs are self-propelling. That means the person can use it themselves. So you don't even need a caregiver to help you. So I believe that there's a lot we can do. What we have tried to do is just pick a little of things we know should be there and implement based on our budget. But we find out that even with all the effort we have made this 1 year to put this place the way it is, we still find out that a lot of people cannot be intentional about using those places. And I'll give you an example before I will ask you to respond. We had a quiz that we're going to organize, and I had advertised for the quiz. It was on Easter. So I asked the members of our center, because we have a WhatsApp group, to read the book of John. And then they are going to be given questions, and then they are going to, the person that gets the highest number, first prize is 20,000, second prize 10,000, third prize 5,000. On the day of the quiz, nobody was in the WhatsApp page. Because once you get into the page, you have to thumbs up to let us know. And I said, we just need minimum of 3 for the prizes that we have. So even if it's just 3 people, we know that there's first, second, and third. I had to start calling them individually. And almost everybody I called had an excuse. I mean, what excuse are you having? You have your device, you have your phone, you have whatever it is that you're using, and you're on the WhatsApp. And then all you need to do, 30 minutes, maximum 1 hour, and then you get this done. The first person who got the first prize, when I called her, she said she was not feeling fine. And I said, what is it going to take? Just encourage yourself. At the end of the day, she won the prize of 20,000. Yet she said she was not feeling fine. So I think there is something, again, maybe even when you care for your senior citizens, some of them are not so used to the care, or maybe the care is too technical that they cannot access it. They are just used to the traditional way of caring, where you have to come and visit them in their house and then tell them you love them with gifts. But if other new forms of engaging so that they won't feel lonely. And each time we have such an event, everybody is so happy. Even the lady who didn't get one question, she said, Dr. Oseji, you must be doing this every month. She was so excited. So some adrenaline was pumped into everybody. So I don't know your experience as a geriatrician, but whatever you can tell us to help us to continue and not give up will be greatly appreciated, Doctor.
Right, Dr. Oseji, I really must say that I admire you for all that you're doing, despite the challenges. I'll start with the last comment. So I sometimes find that you have to find out what it is that they really have value for. So it's like even when we say go into a community and give them a project and take them a project, or you have to first engage them and let them tell you the things that they really have value for. The first maiden engagement that the NSCC had with older people came up with the older people came up with a slogan: nothing for us without us.
Yeah.
So you must find, and maybe this 1 year anniversary gives you an opportunity to do that, and you say, look, we've run our programs like A, B, C, D, E. Which of these have you found useful, meaningful? Which of these do you think we should continue? What other programs should we add on? So it might be a good idea to have that interaction, and actually so that you're rolling out programs that many more are interested in, and you're going to have increased participation. But the barrier for technology is also a major thing. Some of them, they're shy, they don't know, or even the fact that, oh, you're going to be asking questions now, and somebody needs to, it's like being in a classroom, they're backbenchers. I think with older people, they already feel vulnerable, and they feel that they don't know a lot, or they don't know anymore. They're not even any more relevant. So any activity that might appear to heighten that, they would want to draw back from. So I think the first thing is actually engage them, find out what they have value for, that can be what you populate your schedules with, so that many more are participating. I know that the NSCC, you brought up the issue of how the NSCC can help with the with cutting down pricing for caregiver training. You know, so NSCC has been pushing out, at least the DG has been trying to say, look, we need the private sector also to come into the aging space and to actually see aging as an enterprise. So we can get private sector coming who can sponsor some of this
Yeah.
caregiver trainings, because the people who are also providing the trainings have to sustain what they're doing. There are materials that they use, the time of the facilitators and all of that. But yeah, I get the point you've made, that 150,000 might be a high price tag, and it could be reviewed. What the NSCC has done concerning caregiver training is they've actually unveiled a curriculum, because we want to see if we can they can standardize the training. So there should be a basic minimum that caregivers who go for training actually acquire, to make sure that the care that is given to the older people is of a basic quality, and reduces the risk for abuse and all of that, and even bringing more harm. So, and these caregivers can be family members. They can also be people that are being paid to do this job. So we're in the process now of having identified federal institutions that can be that can provide this care, actually start rolling out the trainings. What was the other thing you had brought up concerning the NSCC? So for the model,
The telemedicine, can they
telemedicine,
be
right?
seen? Yes.
So again, so NSCC, yes, I think now you reminded me. The NSCC is federal. I know how federal agencies sort of give the direction that, so it was actually established by law. The plan is that state governments should also domesticate this law, where Delta State, for instance, should definitely establish a senior citizen center or an agency for senior citizens. They take that law established in NSCC to the Delta State House of Assembly, so it's domesticated, and the state can now start rolling out programs for older persons. So that's the plan. We have this at the federal level. The NSCC actually has established state stakeholder fora. So each state of the nation now has an NSCC stakeholder engagement forum. I'm actually the co-chair for the FCT one, and the idea is that these stakeholder groups would raise awareness concerning the NSCC and engage state government and leadership of states to actually be able to pass their own laws at the state level and domesticate this law concerning the care of older persons. So, Berachah Community Clinic should definitely be part of the Delta State NSCC stakeholder group. And you already, you are even a step ahead, as an individual who has already established this. So your center, your project can actually become what the Delta State NSCC stakeholder group can use to advocate to the Delta State government. with the data that you generate from your community and say, these are the things that we've been able to provide to these older people. These are their needs that we have found. It will be a great advocacy tool to the Delta State government and the State Assembly to then domesticate the NSCC law. And this is what is supposed to happen at the state level. The citizens are citizens of the states, so the states really need to domesticate this law and then start rolling out their programs. And a number of states have been keen in, even so. The other thing the NSCC is expecting to happen is that states provide land space, and they can come in and build a model senior center that can be replicated.
Replicated. Okay.
So
that's fantastic.
Good position with this project to definitely advocate to the Delta State government. Now, concerning telemedicine.
Last question. Okay, sorry. Go ahead. I'm listening. I thought you had rounded up.
Yeah. So concerning telemedicine, this again. So this we might have to. So part of what the NSCC has been, and I've been, haven't been part of the technical working group on aging in the country. We've been trying to, the WHO has given a framework. It's called the International Integrated Care of Older Persons, ICOPE. And if we can deploy that at the primary healthcare level, what it would involve is that we train our healthcare workforce at that level, they choose
the public health nurses and the community health extension workers.
Exactly. If we can train them, upskill their, increase their skill to be able to identify some of these aging issues, and there were domains, specific domains that affect quality of life and functionality, vitality, vision, hearing, psychological issues, nutrition. We train them to identify these common things in older people and also learn to refer to the next level for those who require more care. That next level, or all of that process, can happen if we can have, say, Dr. Osi-Ogbu in Abuja, who is able to talk to some nurses or community health.
You just hit the nail on the head. After all, you're in Abuja now, and you're talking to us in Asaba.
Exactly. So that's something that is definitely doable, but it's all part of what we would then be advocating for in every state for this to happen.
And even the training too, like in UK, the caregivers training, the first level training is online. So it's when you have finished the online training, you now go for the one-on-one coaching or the group coaching and things like that before they deploy you and certify you. So that's online training too will be very cost effective. So my last question is concerning erectile dysfunction. I discovered that we just celebrated Father's Day in the center and provided free healthcare for our male members and other males in the community. So we discovered that erectile dysfunction is a major issue at that age. And we want to know whether the knowledge of how to deal with in simple ways, there is the issue of counseling. There are drugs that can be given, but those ones should be prescribed by either the urologist or somebody that has special orientation or training, or somebody who has been training under a urologist. But there are some things like, sex therapy and so on that does not really require too much professional expertise. Is that not something that almost everybody working or having to do with senior citizens should know about? So that when they start making that complaint, at least at the first level, you'll be able to talk to them about other things that you can do, non-pharmaceutical things that you can do that can ameliorate erectile dysfunction in our male senior citizens. I don't know what you experienced in the hospital.
I'm glad that you brought that up, and I guess that was something missing because my talk was
because it was a women's conference presentation.
Because it was geared towards the women. So Hyposexuality is one of those changes that we find with aging, and then the erectile dysfunction. But we know that there are also disease conditions that contribute
Yes,
to erectile dysfunction.
a
So
lot of them,
uncontrolled diabetes.
they have to be ruled out.
Right. So we have to make sure all of those are ruled out, or if they exist, they've been well managed. But one thing is to even have someone come up to talk about it, because it can be a source of anxiety. And if you haven't given a platform for them to be able to talk about it. So we, in the geriatric clinic, we really do not leave any stones unturned, because we know that all of these affect quality of life. And which is also why, in fact, you find some men who tell you, oh, doctor, I went to read about this drug for my BP and they say it can do this. They would rather, not have the reduced libido and all of that. Let this blood pressure not be managed, but hey, I really want to maintain this aspect of my life, my sexuality. So we must give the platform for them to, with freedom, discuss these issues. It helps if this is something the men can talk about with their spouses, where there is a significant other or a spouse. I find that, in this part of the world, it's not something that happens commonly. I found it really refreshing. And in fact, this couple came from Asaba at the time some years ago. I was talking to the woman about doing a mammogram because she'd never done one in her lifetime and she was already 70 at the time. I said, well, we just do the one. She said, doctor, you won't find anything there because this man is always, like all over me. And I know. So I find it refreshing that at that age, they were still that age themselves, and being able to have that freedom to touch each other. So with a couple like that, you can certain that they will talk about dysfunction. So it helps that you're in a relationship with a significant other and you can talk about it. And your partner, the way the partner responds is very important. So if the erectile dysfunction is there and the partner is not the one who is saying, why don't you go and get help? Why don't you go see the doctor? That only makes it worse. But if your partner is the one that is saying, you know what, this is not a major issue, we can certainly get help, but let us do this for now. We find that if people can have a longer period of foreplay, it sometimes helps. And being able to just talk about, because the ED is sometimes not just physical, but psychological. What else could be happening in the dynamics of the home? Is it the anxiety of, oh, I still have school fees to pay abroad and I don't have the money?
Stress could be a serious factor. Work stress.
Yes, exactly. So being able to manage stress also helps with that. But it really helps if there's a partner who is working that journey and saying, we're on this journey together.
Thank you.
Yes, that really helps.
Oh, so with that, we have a wrap. It's been so wonderful, Dr. Osi-Ogbu. I'm sorry that I monopolized all the discussions, but I would like to appreciate Professor Angela Okolo. She joined us.
I was just going to say that I can see her there, Prof.
And then we also have Dr. Sadebe, one of our senior citizens, both in M1 and in Berachah Community Clinic. I also have a director from Ministry of Environment, Mrs. Atiga, and so many other people. There is Emmanuel Egbo. I don't think I know you, but it's so nice for you to have engaged. Misa Oyibe and the others, their names are not very clear. I just want to say thank you. You're the best of the best for staying with us. And this recording is going to be uploaded shortly on YouTube. So whichever page you got our link, just keep checking. We'll put the YouTube link. And this whole 2 hours of discussions, 1.5 hours of discussion, can be used as a training tool to keep going over and over the materials and the information and the guidance and the presentation, you'll be amazed by the time you just share what is there with 5 other people. Even that is a major contribution. Dr. Osi-Ogbu, I do not know how to thank you. Thank you, thank you, thank you. And do have a lovely week.
And God bless you for what you're doing for the older citizens.
Bye-bye. Bye-bye, everyone. Thank you.
Professor Okolo, I would have loved to see your face, ma.
Our prof said it's been a good week.
Yes.
Thank you, thank you, thank you.
Right.
Bye for now.
Bye-bye.